This conference will now be recorded.
Welcome all of you to the class. So in today's class, I'll be just explaining about the POP Q staging because this is sort of a difficult thing, you know, and it comes question from it is necessary for your practical purposes also when you see patient. Apart from this, it is very important for part 3 because the station keeps on coming and they give a diagram and you have to do the interpretation, then only you'll be able to offer options to the role player. And it is also very important for the part 2 because any question can come, and EPCOG part 1, I've seen questions from this. Okay, so this is basically important topic. Now like POP Q, so from where this classification has come. Classification has been recommended by uh, International Continent Society, and it is a joint report basically by ICS and IUGA, that is the International Urogyne Association. And like why it is useful, because it helps in proper assessment and recording the prolapse so that communication is better. But if like it is standard way of measuring and doing the quantification, and if stage 2 or above POP Q, then patient will have a symptomatic prolapse. For part 2 people, this can be an SBA. They can ask you like above what stage of POP Q the prolapse could be symptomatic, so it will be stage 2. Okay, now why we are doing, what is the need of it? Helps in quantification of prolapse. So if I have seen a patient and I make a grade, so if you see that, you'll be able to find out that what is the anterior prolapse, posterior prolapse, cervical descent, actually what it is. So quantification of prolapse can be done. Then compare like when outcome after the surgical repair, when the surgery is done, then you have to find out, what was it before, now what it has come up to now. And it avoids inter observer variation. Like I will say something that it is stage 2, you will say something stage 3, some will say something else. So it is like that observer variation is not there. Apart from this, like it's there is a it helps in written and the public scientific presentation because you can quote. Now what has to be done, what like what has to be done, pre-procedure consideration. So examination has to be done when the bladder is empty and rectum is empty. Okay, why bladder is, we want the bladder to empty, because if the bladder is like full, then there will be underestimation of POP Q severity. Apart from this, like we want to know the maximum extent. So by digital palpation, so position, either it could be left lateral, or it could be standing, or it could be lithotomy. So any kind of position where the maximum as extent can be seen, this can be done. And what you require seam speculum, and there is a a scale to that have a pointed marks for the quantification. Okay, so this is a pre-procedure consideration. Now what we will do, so we do certain measurement, and it is important to know the measurement. There are 6 defined points. Okay, what are the points? Mm, uh, capital A, capital B, and C. These are for like anterior part. And capital D, capital AP, capital A and small p, or BP. So these are the these usually 6 points has to be defined. So they help in identify the anterior prolapse, posterior prolapse, vaginal cough, or cervical descent. These are measured in relation to the hymen and at the maximum valsalva or cuff, because we want to know the maximum extent of it. Okay, now as a hymen point, reference point is hymen, whatever the so that will be 0, and whatever the point it is uh, inside the vagina, or it is called as negative numbers. Okay. And if like something is below hymen, that will be the positive numbers. So like hymen is the that landmark. Inside, if it is inside vagina, it is negative. Outside vagina, it is positive. It is basically very simple. Even looking at that, that grid, you'll be able to do that well. Apart from these 6 point defined points, other points are also recorded. So these recorded points are genital hiatus, perineal body, and tvl. And all points are recorded when the prolapse is maximum, that is maximum valsalva, except one point, that is tvl. Tvl is recorded when the prolapse is reduced completely and the patient is at rest. Okay. So these are the few basic things. Now, the formation of a grid. All of you should know the grid. You should learn the points of grid, because without grid, you will not be able to answer the questions in the exam. So, upper part of the grid, it is anterior wall. So, in the AA, BA, this is anterior wall, and C cervix. Okay. Then go to the lower part of the grid, it is the posterior wall. So AP, BP, and D, posterior fornix. And in the middle, it will be GH, it will be GH, it will be PB, or perineal body, or it will be tvl. Okay. So just remember, upper grid is for anterior wall and cervix, and lower grid is for posterior wall and posterior fornix. If you could remember this much, then rest job is easy. Okay. So same here, I'm speaking, upper grid is for anterior wall and cervix, and the lower grid is the posterior wall and posterior fornix. Now, how to do the measurements and what you guys should know about it. So what is point A? So point A is located in the anterior vaginal wall, 3 centimeter proximal to hymen. So this would be the hymen. Okay. So this would be the hymen. So ideally you have to take the point A, like it will be 3 centimeter above, because it is proximal to hymen. So if the prolapse is not there, you will find point A somewhere here. Okay. Now, and what will be the range? If it is in a point in its normal position, it will be -3, and it has come out completely, like 3 centimeter plus from the hymen. Then it will be like maximum limit +3. So the range of point A, it is from -3 to +3. -3 will be somewhere here, and +3 will be somewhere here. This is the complete range. So these smaller suffix, like small a, this denotes anterior wall. So point A is located in the midline of anterior vaginal wall, that is 3 centimeter proximal to hymen. Maximum range is -3 to +3. -3, like there is no prolapse; +3, full anterior wall vaginal wall prolapse, or full prolapse of point AA. Now coming to point BA is the most distal part of the anterior vaginal wall. Like if the prolapse is not there, then point A and point B will be somewhere here only, -3. Okay. And if the prolapse is there, it will come out 3 centimeter out from vagina. So it will be the complete range of point BA will be -3 to +3. -3 no prolapse, +3 full prolapse. So this is the anterior wall measurement. If you look at this picture, now this is the hymen, you can see this is the hymen, and both point A and point B has come here, and hymen is 0. So you can see BA and AA, both of them are at 0. Okay. So if it is at 0, now you can see it is at 0. So uh, like I'll be explaining the staging later, but this is the second stage, when like most distal part of the prolapse is in between +1 and -1. Okay, and 0 will lie here only, in between +1 and -1. So it is stage 2 anterior wall prolapse. Because A and B both are at the level of hymen, and stage 2 is point in between -1 and +1, and 0 lies in between that. So it is stage 2 anterior wall prolapse. So this is recording of anterior wall. Is it clear? Should I explain again anything? Though I'll be keep on explaining, many examples are there. Okay, let's move. So now this is the pictorial representation. So you can see this is the, like this is like this will be the level of hymen. Okay, this will be the level of hymen. If you see, hymenal tag will be there. So point AA, ideally it should be inside. Okay, point AA should be inside, but here point like any point that is from external urethral meatus, or any point at the level of hymen, and it is below the 3. So from here to here, this measurement is +3. So there is AA is +3. Now BA is the most distal part of anterior vaginal wall. So this is prolapse, and this is the most anterior, most distal part of it. So what is this marking? You can see it from here. So this is nearing nearing 7. So you can see here AA is plus. So anterior wall is completely prolapse here. So AA point is, this would be AA point, and this will be BA point. Okay, is it clear? I have put the diagram, so in your clinical practice also you can do that. And this stick you can find anywhere, in the, this is ice cream stick, and the marking can be done by centimeters scale. Okay, so this way the measurement is done in clinically. This is again the same thing. Now you see this external urethral meatus or hymen will be somewhere here. So BA is here, that is +3, and most distal part is BA. This is here. So from here to here, if we measure, it will be BA, and from here to here it is AA. So AA here is a +3, but BA measurement I have not spoken here. Is it clear? Recording of anterior wall? Any question? No question. Okay. Now, second part would be the recording of posterior wall. Okay. So it is exact same. So posterior wall, this small p is the suffix for posterior wall, and so point AP will be in the midline of posterior vaginal wall, 3 centimeter proximal to hymen. So if this is hymen, so this point ideally should be inside, and it is -3, but here it is completely out, so it is +3. Okay, now BP is the point that will the most distal part. So this is the most distal part of the posterior vaginal wall prolapse. Can you see it here? So this is if you see a marker, it will be nearing 6 or 5, whatever. So the BP here is B6, and AP here is 3 plus. So from here to 3 centimeter is AP. From here to complete prolapse, it will be BP. So AP is 3 plus, and BP is also here. From here to here, it is 6 plus. And if you want to see this picture, here they have not mentioned AP, but AP it is almost outside. So AP will be +3, and this measurement from here to here, this measurement, so here BP is like +4. So when there is no prolapse, AP and BP, it will be -3. When it is full prolapse, it will be +3. Is it clear about the recording of posterior vaginal wall? Any question, people? Okay, no question. Fine. Now, another part. What we have to record, other 2 points, that will be point C and point D. So point C is the most distal edge of the cervix, or leading edge of vaginal cuff in hysterectomy scar. So this is C. Okay, this is C. Now you guys can make out that cervix here, the cervix is like elongated. Here cervix is, cervical descent is there. Okay. Now you can see that you can't see any cystocele or any rectocele. It is if you do the measuring, so C will come some plus here. Okay. And D is the posterior fornix, but posterior fornix is already there when the patient has cervix. If the cervix has been removed in a hysterectomy, then point D will go, there will be no point D. Okay. Now point D, what is the difference of point V? It helps in differentiate whether it is a failure of uterosacral ligament complex or whether it is cervical elongation. If it is cervical elongation only, then C will be plus and D will be minus. Okay. So this way it will help in finding out whether it is prolapse or whether it is only cervical elongation. In cervical elongation, C will be plus but D will be minus. Okay. Yeah, this I have already told. And if the absence of cervix is there in the hysterectomy, then point D is not there. Okay, there is no point D. So this is the measuring of C and D. Now you can see it here. So C from hymen as a reference, they are measuring. So it is coming here, here somewhere 8 or 9. So it is C plus. So this is cervical elongation, this is cervical elongation. Okay. And if the they will reduce the prolapse, then from here they will measure posterior fornix. But you guys can see the posterior fornix is already out. So there is no posterior fornix, posterior fornix is already out, so it will be, D will also be plus here. Okay. Is it clear? Any question? No question. Okay. Now three other measurement. uh, these are just description only, but they doesn't help in the quantification of prolapse. So this is genital hiatus. Genital hiatus is measured from mid external urethral meatus, like from here to here, that is posterior margin of hymen. So this is genital hiatus. Okay, this is genital hiatus. So it is used in the definitions, and you have to teach your students so that you should know it. TVL is the total vaginal length. So when the prolapse is completely reduced, then TVL will be measured. And coming to the perineal body, it is from the posterior margin of the hymen, or the this is the posterior margin. So this is the posterior margin of hymen till mid uh, anal opening. So this will be your perineal, this is your perineal body. Okay, usually perineal body le- length is like 4 centimeter. So these are the marking done: GV, PV, GH, PV, and TL. This marking is done in the middle grade. Now you guys can see the same thing. So here they are measuring genital hiatus from mid external urethral meatus till posterior hymen. So this is genital hiatus. Perineal body from posterior fornix, so this is posterior fornix hymen, to mid anal point. This will be somewhere here. So this is perineal body measurement. This is perineal body measurement. Okay. This would be very useful because you know in our PG exams we are given a case, and we have to that time quantify, and we have to tell it to examiner. Because of that I have put these pictures, so that everyone idea of measurement and recording of POPQ will be crystal clear in practically also, rather than the topic is for exam. Now staging. Now once the measurement has been done, what will be the next point? So next point is that you have to do the staging. So it is very easy. So if all the points are less than or equal to -3, then the stage 0, no prolapse. Stage 1, when b 6 points are less than -1, So less than -1 would be stage 1. Okay. When any of this point we are measuring lies in between -1 to +1, -1 to +1, it will be stage 2. Okay, the picture that I have shown, we have got a measurement 0. Because of that, I said that it is a stage 2 prolapse. Stage 3, when any of this point is more than, or sorry, less than and equal to tvl minus 2. When they are less than or equal to tvl minus 2. And stage 4, any point like b a b p and c d, they are like here it should be more than, and here it should be less than tvl minus 2. Okay, it is less than tvl minus 2, and here it is more than tvl minus 2. Here it is more than tvl minus 2, and here it is less than tvl minus 2. So let me repeat it. In stage 0, all will be like -3, and less than or equal to -3. Stage 1, these points will be less than -1. Stage 2, the points will be in between -1 to +1. Stage 3, any of the point will be less than tvl minus 2. And in stage 4, these points like b a b p c and d, they will be more than or equal to tvl minus 2. So this is the staging. Now staging is important because in the exam you have to do staging also. So now how we can do that. And so this is the practical aspect how the POPQ is done. This would be necessary for you guys if the role player asks you any question in the teaching station. Apart from this, the clinical practice. So put the patient in left lateral lithotomy position at the whatever the comfortable is. Then identification of hymenal remnant is done. We know the hymen is reference plane 0. Then the seam speculum is inserted. Usually we want to depress the posterior vaginal wall, and we ask patient to cuff. After that, we do the anterior wall measurement, that is AA, BA, and C, that is a cervix. So top row, top grid, top grid is measured and written, and it is plotted here in the grid. Then, what we do next, cervix, speculum will be depressing the anterior vaginal wall. Now, anterior vaginal wall is retracted by the speculum, and we ask patient to cuff, push, or bear down, and all rule with the like scale or ruler. The posterior vaginal wall or with point D is measured. Okay, posterior vaginal wall or point D is measured, and it is written here. After that, speculum is taken out, and measurement of genital hiatus, perineal body is done. After that, we would reduce the prolapse, and then measurement of tvl is done, that is from hymen to inside. So that is plotted in the inside. After that, we like uh, ask patient to confirm the finding when the patient is standing. That whatever we have done, if this is in the lithotomy position, we again ask the patient to stand and bear down and confirm the prolapse in relation to the hymen. That would be sort of a confirmation of the grid that we have made. Apart from this, then the grading can be done, staging can be done, whether it is an anterior prolapse, posterior prolapse, vault prolapse, cervical descent, or like what kind of prolapse it is. Then the staging is done. Okay, so this would be the practical aspect of doing it. If you are in your like postgraduate exams, when when someone asks you to show, so this will help you how you will actually do that. Yeah, so we should have a clear idea about it. Any question at this stage, any one of you? Any question? Any question? No question. Okay, so I want you guys to stage this prolapse. Any one of you can answer? Anyone want to say, like people should say something. Okay, come here. So can you, what is 0 and plus here?
Hello.
What is 0?
Hello.
Yes,
Hmm.
yes, one by one. Yeah, what is this prolapse?
Stage 2 anterior vaginal wall prolapse.
Yes, this is stage 2 anterior vaginal wall prolapse, because it is -1 plus 1. So the 0 is lying between then, and small a belong to anterior wall. All other things are negative, so we are not worried. Stage 2 anterior wall prolapse. Very good. Now what is this?
And this is
Superior vaginal
posterior wall prolapse, ma'am,
stage.
because the APBP is zero at zero. Stage 2 posterior.
Yes. Yes. So here, if we if we have to make a quick diagnosis, we just see 0 and plus. So it is 0. P for posterior wall. So APBP 0. So and it has to be posterior wall. So it is stage 2 posterior wall. Very good. Now someone can answer this. Difficult, but yeah, you guys can do some try.
Prosidentia, ma'am.
Yes, vaginal
Yeah.
portal.
stage stage 4
Stage 4.
anterior and posterior wall prolapse.
Yes. So anterior wall is completely out, posterior wall is completely out, cervix is out, and D is out. Everything is out only. It has to be stage 4, but let me explain you. So people here, if you see like all are plus, that we know that it is the prolapse is anterior and posterior vaginal wall prolapse is there, but we have to stage it. So how to do staging? This is tvl is 9, okay, and do tvl minus 2, so it is 7. And so any of the point, if it is more than tvl minus 2, then it will be stage 4, so or equal to it. So here you can see that point D and C, they are equal to tvl minus 2. Because of that, the staging is stage 4. Okay. Now this is a very small, question. So let me the answer. What
AP.
is,
AP.
AP.
it is the answer, and I need not to explain. You know that. Answer this.
Ma'am, D
D.
point will be omitted.
Yes, D
D.
point will be on it. Yes, because there is no posterior fornix. Okay, this only one or few questions are there. Part these are few questions. So what is vaginal vault or cuff?
C point.
Point C. Okay. So what here THBSO has happened. So what you will not measure?
G.
D point.
Yes, D. Okay. Now again, tell me what is this prolapse and staging?
And anterior.
Yes, it is anterior prolapse. So we have to see plus, and this is this, and we have to do TVL minus 2. TVL minus 2 will come 4, but here B6 is more. Point BA is more than TVL minus 2. It is stage 4. It is stage 4 anterior wall prolapse. Okay. Okay, another answer.
Stage 4 posterior wall
Posterior.
prolapse.
8 minus 2 will be 6.
Yes, 8 minus 2 will be
Stage
6.
3. Stage 3.
And BP is less than TVL minus 2. BP is
Yes,
5,
ma'am.
so it will be stage 3. So it is stage 3 posterior wall prolapse. Okay, so this is the question, but I have put the grid. Okay, in the grid I have put the answer also. So like they have given a grid. This question was there, so I have put a grid here. So you guys can see it from here. That here anterior wall prolapse is there, and TVL minus 2. TVL minus 2 is 4, and like this B6 is more than TVL minus 2. So answer is stage 4 anterior wall prolapse. So it will come somewhere here, E. So stage 4 mainly cystocele is the answer. Okay. Again, can someone want to do it? Can someone want to tell, or should I discuss this? Okay, let me tell you. So this is the grid, people. You can see from here. So here, like it is plus, like anterior wall is coming out, but you see C is also plus. C plus means cervical descent is also there. And here posterior wall is 0, so posterior wall is stage 2 prolapse. And like TVL minus 2 is 6, and your BA is less than TVL minus 2. TVL minus 2 is 6, and BA point given here is 3. So as it is less than TVL minus 2, so it is stage 3 anterior wall prolapse. So this denotes stage 3 anterior wall prolapse, stage 0 posterior wall prolapse, and cervical descent. Okay. So like stage 3 anterior wall, stage 0 posterior wall, and cervical elongation, or you can say cervical descent. Okay, this again I will put the grid.
Posterior wall will be stage 1, no ma'am, between minus 1
Yeah.
and plus 1. It will be stage
Yes.
1, no ma'am. No.
Where
Posterior wall will be stage 1, ma'am.
no, this picture it is 0 only.
Yes,
APBP is
ma'am.
0.
Yes,
Yeah.
ma'am. Then it will be between minus 1 and plus 1,
So
no ma'am.
yeah, so it will be stage 2. So I wrote
Okay, ma'am.
posterior wall stage 2.
Okay.
Yeah, so different walls also have got different staging. So anterior wall is stage 3, posterior wall is stage 2, and cervical descent.
Thank you, ma'am.
Hello. Excuse me, ma'am.
Yes, yes.
Yeah, ma'am, could you please explain about the TVL minus 2 in the previous picture?
TVL is 8. It is given TVL. And
It's
minus
8.
2.
So
So minus 2 is
8.
6.
Mm-hmm. So
And
normally cervix point should be minus 6. Now it's 4.
C plus 4. Any plus means it is outside the hymen. So cervix is 4 centimeter outside the hymen. So it is cervical descent. Cervix is coming out.
Yes, ma'am. Okay.
Okay. Where is the
Yeah.
confusion?
Yeah, I was thinking about the stage. According to A plus 1 and B A plus 3, it's stage 3. But I was
Yes.
confused for the C cervix plus 4. So
So
we will.
if you consider TVL minus 2, then it will be again less than 6 only. So it will come stage 4, stage 3 only. It will come stage 3 only because it is less than 6. That is TVL minus 2.
Okay, ma'am.
Okay.
Okay.
Yeah.
Yeah.
So
Thank
this is
you.
also
Yeah.
TVL minus 2, less than, this is also less than TVL minus 2. So this will be anterior wall, and the cervix is stage 3. Posterior wall is at 0. So posterior wall is at second stage descent. Posterior wall stage 2. Okay. Is it clear?
Yes, ma'am. Yes. Thank you.
Hmm. Okay, now
Would it
here
be
also is, yes.
so how is zero will be a stage two? Can you explain me, please?
Here, if you do the counting, there will
Yes,
be -1, then 0, then +1.
so it's
So
written there -1 to if all in the -1, it will no prolapse. If -1 to more than -1 and then less than +1, it will be 1. I think so, or I'm confusing.
no, see,
Hello.
-1, if you
Uh-huh.
if you have to put a counting, when you
Yes.
do counting and you start from minus, so it will be -3, -2, -1, 0, then +1, +2,
Yeah, yeah.
+3. So
Mhm.
zero, so zero will always come between -1 and +1. And a stage two is whatever the point, if they lie in between -1 and +1, then it will be stage two. So zero lies in at like in between -1 and +1, so it will be stage two only. These are the integers we used to read in mathematics. Have I answered your question? Is it clear now?
Yes, yes. No, now it's clear. Okay. Okay,
Yes.
thank you.
Hmm. Okay, I would like one person to do a station. Who want? One person. Any volunteer? No one wants to do.
Hello, ma'am.
Yes. Who's speaking?
Monica. Monica, ma'am.
Huh?
Monica.
Okay, you want to
Yes, ma'am. If nobody is coming, please make use of me, ma'am.
do? Okay, do it.
Okay.
So yeah, when you want to start, let me know so I'll put the timer on.
Yes, ma'am.
Whenever you wish to start, you can.
Yes, ma'am. Okay. Shall I start, ma'am?
Yeah, start. I'm putting timer
Mm.
on. Yes.
Mm. Hello, I am
Hello.
Monicam, ST5. Glad to meet
Hmm.
you. Are you William?
Yeah. Yes. I'm
Uh,
Esteban here.
uh, okay. Uh, do you have any problem here in the department? You have recently joined, no?
No. Like everything is going fine, and I'm really enjoying working here.
Okay. I'm really happy to hear, William. If you have any problem, you can come to us. We are all colleagues. We are here to help you. Mm.
Yeah.
I came to know that you wanted to learn about this POP Q system. How you developed this interest? May I know that?
Because I have seen my seniors colleague talking that they are
Mm,
doing some
mm,
staging of prolapse, and I
mm,
found it very difficult. So I just thought of
mm,
coming here
mm.
and
Okay.
discussing.
Okay. What do you know about this? Do you know the points and all? Do you know
No,
anything
I don't.
about?
No, I
Mm.
don't. No, I
So,
don't know anything. No idea.
okay, okay. I'll tell you. If I'm not clear, you can interrupt me at any time. See
Mm-hmm.
here, one grid is present in this table. No,
Mm-hmm.
please have a look at this. The
Mm-hmm.
points on the upper line, they are first one is called AA. That
Mm-hmm.
means we are taking the hymen as the starting point. That is a zero. If
Mm-hmm.
-3 means it is 3 centimeters above the hymen on the anterior middle wall. Am I clear? Anterior wall in the midline. So it is
Mm-hmm.
-3. That -3 is the normal position. Similarly, next column shows -3. That is the A, sorry, big A, small, ma'am, 1 minute, ma'am. That is called BA. That is the BA means anterior wall, um, the distal portion of the anterior wall, that is also above 3 centimeters above the hymen. So this is the normal position. So there is no prolapse. Am I clear so far?
Mm-hmm.
Yeah.
Yeah.
So the next column shows -6. This -6 means that is the position of that is C. C means the cervix. That is external os. That is also okay, normal position. So the anterior wall and the cervix are normal. The next second column shows the 4.5 is the genital hiatus, GH. So that is the measurement of the distance from the middle of the external meatus to the posterior midline portion of the hymen. That is 4.5. That's also normal. Then 1 is the perineal body. From the posterior midline of the hymen to the middle portion of the anal region. That is the 1. The next one is the 8 centimeters. That is the TVL. That is total vaginal length. This this is about 8 centimeters. Am I clear so far?
Mm-hmm. Yeah, yeah.
Can you can you tell me what is TVL?
Total vaginal length.
Ah, you're a fast learner. So next we come to the third one. The third column shows in the first one +2. That is the this shows the posterior wall, about the posterior wall. That is, it shows +2 means the anterior and the posterior wall, a portion which should be at -3. That is the
Okay.
lowest point of the posterior wall should be at -3 as in the above first line. But it has come to +2 position. So it has descended down. Am I clear? This is called
So
AP.
what is how to define AP?
Sorry, pardon, ma'am.
Yeah, how to define AP actually?
AP is the uh, a point which lies on the posterior wall in the midline about 3 centimeters above the hymen. It should be 3 centimeter above the
Well,
hymen, but now it is +2 centimeter below the hymen. So it shows a descent. Similarly, am I clear so far?
yeah, yeah.
Okay, the next one is the +5. That is the, we call it as BP. That is the portion above the level of the AP on the posterior wall. It comes to +5. So it is 5 centimeters below the hymen. So this is also abnormal. Whereas the D, that is the empty dash is seen. So D means that is the posterior fornix. It is not there because this
Mm.
patient should have undergone some hysterectomy. So this is that point is marked as the dash. So this shows that. Can you come to any conclusion? This is a descent of the posterior vaginal wall alone. Am I clear so far?
Okay. Yeah, yeah, yeah.
Oh, okay, okay. But there is some measurement called total vaginal length -2. So the total vaginal length is 8. If it is minus, if you subtract 2, that will be 6. Here, all the measurements here, both 2 are uh, less than 6. So this will be belonging to um, stage 3 prolapse of the posterior wall. Am I clear so far?
So is it a vault prolapse?
It is a posterior wall prolapse. The vault means that C is in the normal position. Only the posterior
Mm-hmm.
vaginal wall is coming down. It is
Mm-hmm.
descending down. So this is a posterior vaginal wall prolapse. In other word, we call it as a rectocele. So the patient may have some symptoms like constipation and digitation like that. This is the This is called a quantification method, so that there won't be any discrepancy between um, uh, the documentation will be uniform. For that, it has been used. Uh, can you
Okay.
tell me what is the point C? That is the minus
Yeah,
6. That is a
cervix.
cervix. Very good. You're a fast learner. If you do you want to have any questions? How to find before finding this, we should make the patient lie down in the lateral position or in the lithotomy position, and then with the help of the speculum, we can do mild after in the presence of chaperone with the consent of the patient. We can retract the posterior vaginal wall. She should have emptied her bladder before the examination as usual. Then we can retract the posterior vaginal wall and ask her to cough. And if the anterior vaginal wall descends, we can see the site of the hymen. From there, we can measure. Similarly, we can keep the speculum on the anterior wall, and we can measure the descent of the posterior wall. Am I clear so far?
Mm-hmm.
Okay. So I will show you some other grids also, and I will demonstrate in the patient next time if this patient comes into the OP also. So I will give you
Mm-hmm.
the patient information leaflets, sorry, this grids and the documents or the surgical material regarding the prolapse. I will give you. You can go through, and if you find any difficulty, you can come and we can have a discussion once more. We can go together and we can study together. How does it sound?
Yeah, that's fine.
Okay. Uh, how was the my session? I'm really worried whether I have cleared your doubts.
Yeah, yeah, very
Do you have?
nice. Yeah.
Okay. Okay. If so, I want to have so many sessions with you, and thank you, William, for your time. I'm really appreciating the way you have talked with me also. So we shall we go for a coffee and come? Thank you, William, for your time,
Okay.
ma'am. Thank you, ma'am.
Welcome. Wonderful. Very good.
Thank you, ma'am.
Hmm. Yeah. But in the exam, you have to kind of explain, all points you have to explain. And maybe in the exam, this grid will not be there, only diagram will be there. So you have to
Okay.
see the diagram and you have to draw the
Uh,
grid.
uh.
Yeah. Here, I missed removing grid from here.
Yes, ma'am. You have made it easier for me, ma'am.
Yeah, but exam will not be so easy. Grid will not be
Okay,
there.
ma'am.
You have to make a you on the pen and
Have
paper.
to draw on
You have
white.
to
Okay, ma'am.
make a grid
Hmm.
and you have to identify each point to tell
Okay.
him. Okay, but yeah, you did it very nicely. Wonderful.
Thank you, ma'am.
Okay,
Ma'am,
so
please
coming
pray
to
for me,
answer,
ma'am. Thank you, ma'am.
yeah,
Please pray for all of us. Thank you, ma'am.
yeah, yeah, always in my prayer. Don't
Thank you,
worry.
ma'am.
Okay,
Okay.
so coming to answers, so what you have to say. Hello, William. How are you doing today? And I can see that. How long are you with us? How is your training going on? I can see that you today you have come and you want to know about PopQ. Yeah, it's a very wonderful topic you have chosen, and ideally, we clinicians should have a clear knowledge about it. So, can you tell me why you want to know about it? Have you seen any video or have you seen someone doing PopQ measurements? Whatever he says. Okay, so in today's session, set some agenda. In today's session, what I'll be doing, I'll be just, giving, tell you the importance and help you with all the point measurement. And if you can, stop me at any time if I'm not clear. Okay, how that sounds to you? Okay, now like PopQ is a prolapse quantification system. It is given by the International Continent Society. And why it is given? So that there is correct quantification and we can assess the outcome of after the prolapse, after the surgery, and we can use it for the publication purposes, and inter-observer bias will not be there, isn't it? So can you tell me one point why the POP-Q is important? Now, in the POP-Q, let me tell you, we measure 6 points. That actually there is measurement of 9 points. 6 point we measure, and that will help in assessment of prolapse. And 3 like other descriptive point measurement is there. Now some golden some rules are there. So reference what we are using is a hymen, and any point proximal to hymen will be negative, and we are happy with the negatives. That means the patient has no prolapse. Any point that is plus, that will be prolapse, so we would be concerned about that. So all above hymen negative we are happy, no prolapse, and before it if it is plus points it is prolapse. Okay. So and the standing, it can now coming to the position, it could be standing left lateral, but it has to be done with the maximum valsalva, all the points except one, that is tvl. tvl is measured when the prolapse is completely reduced. So can you tell me what is a reference point, and what point we require tvl prolapse to be reduced? Yeah, very wonderful, you are doing very fast. Now in terms of measurement, so we measure 3 points. So 3 points for the interior wall, and we make a grid. William, let me draw a grid for you. Upper column of the grid will be for interior wall. So small a always interior wall, small p always posterior wall. Just be look at the posterior smaller points, okay, smaller alphabets. So top grid would be A, B, A, and C. So this will be the measurement of anterior wall. And let me tell you first. So now what is the interior A point? And A point will be like, put that. So A point, how to define it? So this will be the point on the anterior vaginal wall, 3 centimeter proximal 3 centimeter proximal to the hymen. So this is A point. And what is BA point? BA point is the most distal part of anterior vaginal wall, and C would be the cervix. Okay, so so these points, AA, BA, and C, these are put in the interior, like upper part of the grid. Now come to the lowest part of the grid, that is for posterior wall and posterior fornix. So point AP, BP, and D will be there. So coming to AP, it will be same as AA, that is 3 centimeter proximal to hymen. So if there is no prolapse, AP and BP, they will be -3, and they will sort of at the same level. Okay. And BP is the most distal part of posterior vaginal wall, and if there is no prolapse, then it will be it will be -3. And so this is BP, and D will be the posterior fornix. So these are the so upper grid is the anterior wall measurement, that is small a, big A, small A, B, A, and C. Lower part of grid is B, posterior wall, BP, AP, BP, and D. Okay, so can you tell me what we are putting in posterior wall? Yes, you are really learning fast. Now in terms of TVL, so it is reduced, then it will be complete vaginal length. Okay. Now coming to the 3 descriptive points. 3 descriptive points are genital hiatus. So genital hiatus will be, let me explain you, it will be from external urethral meatus to posterior margin of hymen. And TVL would be like length of vagina. And posterior perineal body, it will be from posterior margin of hymen. So it will be from posterior margin of hymen, this is posterior margin of hymen, to the mid anal point. So these are the descriptive points. So can you tell me what are the descriptive points? Yeah, wonderful, you are learning very fast. So this way, first we need to make a grid. Does it make sense for you? Now let's come to the patient that we are going to study. Now if so this anterior wall, and upper grid, the anterior wall, all are negative. So we are happy, there is no prolapse. This is the descriptive part. Okay, that is also fine. But this is here we can see plus. The moment we see plus, there would be prolapse. So small p for the posterior wall. So there is a prolapse of posterior wall. Now if we like AP is 2 plus, BP is 5 plus, so posterior vaginal wall prolapse is there. Okay, now this is the prolapse, and now to stage it. So for staging, from tibial we'll do -2. So tibial is 8, -2 it will be 6. So the BP, that is +5, it is less than tibial -2. If it is less than tibial -2, then it will be stage 3 prolapse. So the patient what we are having is having stage 3 posterior wall prolapse. So can you tell me why we are putting this in stage 3? Yeah, wonderful. You have really learned fast. Now, apart, so how was the today's session? And yeah, I found you to be very enthusiastic learner, and I can give you certain handout for it. You can practice it. Whenever you find any difficulty, any trouble is there, you can come back to me. Enjoy, have a lovely day. Thank you for your time. So this would be the answer. Any one of you have got any question? Any one of you have got any question?
Dr. Priyata, about BB, is it short BB1? Was it in one BB? Is
Yes,
it short,
yes.
the distance between the
It is,
hymen?
it is short. Perineal body is short. Ideally, perineal body should be, ideally perineal body is nearing 4 centimeter. Here it is perineal
Yeah,
body is small, but we are doing staging of prolapse. In that,
yeah,
we have got nothing to do with it because these are the descriptive points. So that means this woman, while the delivery or whatever, have so much of a tear or something like that. Because of that, the perineal body is reduced.
yeah, risky. Yeah, okay, thanks.
Yes, but actually, the station is about quantification, POP
Doctor,
Q.
in such,
And yes,
yeah, in such condition, need posterior perineal, posterior colpo-perineorrhaphy. So perineum, it may
yes,
be short that it
yes.
may be so that why
So
they call it posterior colpo.
if the role player asks you what will be the surgical treatment, so your answer will be like posterior vaginal wall repair with or you will say colpoperineorrhaphy. Here perineum
Yeah,
reconstruction will also be done. So here, like
yeah,
if like perineal body is +4, then a surgical treatment will be posterior vaginal wall repair. But as the perineum is
correct.
short here, so the answer will be um, like
Posterior
colpoperineal
colpo-perineorrhaphy. Yeah, yeah,
posterior
thank you,
repair and
doctor. Thanks.
perineal. That would be the answer. Yes, very very good point you have asked.
Yeah, thanks, Nectar, for your answer. Also, always you give the to the point during your answering. Thanks,
Right,
Nectar.
the exam is like that only. You should have very crystal clear idea, and in small
Yeah,
with less words, how you can with a confident you can put your your words. So that is what the part 3 about.
yeah,
Ma'am, I have
correct.
a
Any other
Yes,
question?
doctor.
yeah, ma'am. I have a question.
Hmm.
Ma'am,
What is
in
the
this
question?
example, yeah, ma'am, in this you asked the role player question that is this vault prolapse? Because, ma'am,
Mhm.
over here, see this patient as there is no D,
So
so
this is
it
not the
means
wall
that
prolapse.
yes, yes,
Kulsum,
ma'am, I'm
Kulsum.
saying yes, ma'am, it's not vault prolapse, and ma'am, D
No,
is
no.
not there, so it means already hysterectomy, and C is the vault, or is
Vault.
it the yeah,
No.
it's not. Yeah.
See, hysterectomy has been done. No uterus.
Yes,
But vault is
because
at its
you
place.
yes,
Vault is
yes,
fine. So
yes,
because of that, sacral colpopexy is not the answer.
yes, ma'am.
Got it?
Yes, ma'am.
Yes. So now you see such a small diagram and so much of information. Any other question, people? Any other question, people? No question. Okay, so like practice this pop q in, like clear, the clear concept, because it comes in MRCOG part 2, APCOG, and part 3. Recently the station had come, because of that I have put this class. And like this time I'm doing live circuit for part 3, 15th October. Anyone interested can come to Delhi. And thanks for joining. Any other query, you can ask me now, or you can put in the Telegram. Any question? Okay. Thanks, people. All the best for your exam, and all of you are in my prayers always. Bye. Best of luck.
Thank you so much, ma'am. Thank you, ma'am.